This is such a great idea for today's segment. Of course, we're going to bring our pets to you or our veterinarian if we have a problem, but sometimes we're the emergency first responder, right?
You bet. You know, you're there first before you take them to the vet, so I want to give you some tips on what to do in case you can't get them to the vet quick enough.
Great. Yeah, take it away. We're ready.
Okay, so a lot of people worry, about if their pet gets into toxins or poisons. I had a dog last week that ate a few pounds of grapes, Paul, if you can believe it. And they're really toxic. And so what do you do at that point? Well, of course, they rushed the dog right to the veterinarian, which was great. But what if you can't? A lot of people call and want to know what to do to induce vomiting. You have to be careful because if your pet eats something caustic or toxic, the last thing you want is for them to vomit it back up and burn their esophagus. So a lot of people go online and they find that peroxide is a great way to have your pet vomit. However, you do need to be careful. Check with your veterinarian, or I like to have numbers available. For example, the ASPCA has a fantastic poison control 800 number. Have that pasted to your refrigerator. Have your veterinarian's card pasted to your refrigerator as well. And then also, I like to have a relationship with a veterinarian about 50 miles away from home in case there's a disaster, catastrophe, or you just can't get back home. Say you're traveling, for example, you let your dog out to go to the bathroom, and you're 50 miles from home. You need a veterinarian or somebody in an emergency case. Have those numbers available.
Yeah, hey, Jill, I know, raising my kids, we always had syrup of Ipecac in the house in case. But that doesn't work for dogs. And also I wanted to touch on, some people have 5-pound dogs and some people have 100-pound dogs. We have to be mindful of that too, right?
That's right. And there are selected doses per weight, per pound of peroxide. 5 to 10 milliliters per pound is the recommended dosage. However, I'm not advocating that people do this. Also, Paul, I want to make sure you understand too, Ipecac is off the market. It was great stuff when we were growing up, but people abused it, and it wasn't always the right thing to use, so they've pulled it off the shelves.
Okay. Our time's going to get away, and I know you wanted to touch on punctures and bites and other wounds like that.
Right. Be careful. Make sure to flush them. I like to use sterile water or saline when flushing. Have some just basic topical creams. Get your pet to the veterinarian as well. The one other thing I wanted to really quickly mention is when an animal's hit by a car, a lot of people get bit because they try to move the animal. So you can use simple things just around their nose like a little muzzle, just a bandana or even a leash, because the last thing you want is for you to get a puncture wound and get bit. And also, if you're going to transport them, just pop them onto a flat board. Strap them down, get them to your veterinarian immediately.
I'm impressed with how Diva has been hanging on your every word. She's been down there just watching you like, your mom. Thanks, Dr. Jill. Really good advice. We appreciate it.
Thanks,
and the advice about having the phone numbers handy, I'm sure, is just really, really good. If you would like to schedule an appointment with Dr. Jill, or you know what, she's mobile. She can come by your place as well. Check out her website. It's drjilldrjyl.com, or you can call her up. The phone number is there on your screen, 916-989-0738.